Hello, Dr. Zheng.
This is my prostate book.
Yeah, I was reading your prostate book and I came across an article on phytoestrogen. And I'd like to have more information from you on this as far as causing prostate problems in men, enlarged breasts, weight gain, even possible breast cancer.
Yes, the reason I like to talk about phytoestrogen is phytoestrogen can occupy the little receptors which the hormones will combine. Receptors is kind of protein when the hormones released, and those hormones combine with those protein, and then it change the whole metabolism, change the metabolic process. So when you have higher level of estradiol, which is the bad estrogen, it will stimulate the breast, the prostate, anywhere you have receptors. Even in the brain, you have that protein receptor which can combine with the hormones. That's why one of the reasons when men get older, they are more emotional because the estrogen level goes up, testosterone going down, and then men can think about more different things at the same time. Well, when they're young, because like when you are 20s, you don't think about the death. You just go to the war and fight for your country. But your age, you probably think about my health, my children, right? So that's how estrogen works. And phytoestrogen can occupy those little receptor so that the bad estrogen will not stimulate the breast, the prostate.
Okay, when you mentioned protein, my kidney doctor, when he does blood work for me, I have high levels of protein in my urine. That has nothing to do with this issue. That's a separate
Yes.
issue.
Yeah. I think as a grown as a grown up, we don't need so much protein. So when the kidney started leaking the small protein, which metabolized from the food we eat, that means the kidney function is compromised. But I look at your result, the protein
Yes,
level actually is
it's
lower.
fine. Yeah.
Before, like a few years ago, when you are on high dosage of statin and high dosage of painkiller or other medications, it all goes through the kidney, so the kidney function is a little bit compromised. But now you lower the statin, you lower all the medication you are taking because you change the diet and lifestyle, so your kidney function is improved. And important thing is when your kidney function improved, that little gland called adrenal gland sitting on the kidney, there are two glands that produce a little bit of hormones, testosterone, estrogen, progesterone for women. So if you can keep your kidney function in a good condition, your adrenal gland is functioning better, and actually you can also produce a little bit more testosterone. That is why at age of 80 or 90 years old, a group of men who are healthy, they don't have ED, even they're not as strong as when they were 20s. And the other group of men will have enlarged prostate and frequent urination and all of these prostate problems. To prevent that, and I want you to eat more phytoestrogen.
Okay, I'll do that for you.
Yes, phytoestrogen include um, like sweet potato, tofu, and also raspberry leaf tea and some herbs, Chinese herb, angelica, and other herbs. So in order to increase those phytoestrogen, you are going to increase those food intake. And you would argue saying that, oh, tofu, that will increase the cancer of breast or prostate. Actually, it's the other way. The European study shows that people who have already had breast cancer, and one group eat tofu regularly, the other group eat not eating tofu, avoid tofu, and a group who have tofu regularly actually have longer surviving time and a better quality of life.
Very good. Thank you.